older cats do run into appetite problems. And if a cat is hyperthyroid, it's even more common. Now, most of the time it is no big deal, nothing to worry about, and you'll clear it up fairly quickly. But there are other times and it gets worrisome. So I'm going to talk about some of the causes, some of the tricks and treatments. This is not an all-inclusive video. Cats are too complicated for that. And for most of this, you should be in contact with your vet. Some of these are prescription items, some are over the counter, but your vet should have an idea what you're doing. That does not mean you need to call your vet as soon as the cat skips a meal. Again, that is usually not a problem. We will get into more of when is it a problem and how big a problem. As for some of the causes, of course, dental problems can be a big one. And telling whether or not a cat has dental problems isn't easy, even if the vet is good with cats. And too many vets aren't good with cats, and if they take a look in the mouth, it's not much of one. Sometimes the only way to really be sure is anesthetic and x-rays. But hopefully it doesn't come to that. Also, kidney problems. If the creatinine is getting up in the 2.5 range, that can be high enough to cause problems for some cats. Or if the phosphorus is up in the 5 or 6 range. And again, this is on the scale used mostly in the US. I'm not going to deal a lot with the kidney issues in this video. That's in other videos. It may also just be sort of a minor passing virus that comes and goes in a day or two. You know, in humans, we just say it's a stomach bug. You know, a 24-hour bug, something like that. So be patient. With a little luck, it clears up. Now, the complication there is that when a cat doesn't eat, it causes changes in the systems that make a cat not want to eat. It gets to be this self-continuing cycle, and you have to break the cycle. If you don't know why the cat won't eat, and if you've already tried changing foods, next things to try would be just raising the food and water dishes 2 to 4 inches off the floor. Sometimes, if a cat doesn't have to lower their head below stomach level, they can and will eat. Even if it doesn't break the cycle once it's started, it's not a bad thing to try. And you might as well go ahead and give it a shot before the appetite problems come around, and maybe you'll prevent them. Then you get into the non-traditional foods, things you're not going to feed a cat all the time. That might be some good treats or even some bad treats. There are times that if you just give a few treats every couple of hours, it breaks the cycle because it gets rid of the stomach acid that's building up and making a cat feel like not eating. And I'm going to backtrack for a moment because I did not mention under causes that sometimes it's actually an upper respiratory issue, because if a cat doesn't smell their food well, they won't eat it. So watch for sniffles and sneezing. Treating the upper respiratory is sort of a different issue, so I'm not going to get into that. just watch for those signs and symptoms. As for the if treats don't do the trick, you go to other foods. First, the do not feed list, the toxic things. Onions, avoid it. Chocolate, avoid it. Artificial sweeteners, avoid it. Read the labels. For example, early stage meat baby foods are going to be one of the things on the list to try. But if you aren't using some of the earliest stages, you'll find onion or onion powder on the ingredient list. Avoid it. So, baby food is a good thing, particularly I would say the beef, chicken, or turkey. I recommend avoiding ham and pork products for the time being. While most cats are fine on those, sometimes when the stomach is upset, it seems to continue the upset. Again, there's no real significant documentation on that. It's just something that we've observed in the groups. Sometimes setting those aside for a while is necessary to break the cycle. Other foods you might use, yogurt. Even though the level of probiotics isn't all that high, some cats will eat yogurt when they won't eat anything else, and it seems to settle the stomach. And just because yogurt is a dairy product doesn't mean it's bad for cats. And actually, raw milk should be on the list of things to try. Pasteurized milk can upset the system. Raw milk, which still contains the digestive enzymes, can actually help the digestive system. I wouldn't start with more than a teaspoon or tablespoon at a time because some cats just aren't used to it. And sometimes tablespoon 2 or 3 times a day is enough. And of course, not every cat likes it. Fish is usually on the minimize list, but in this case, if that's what it takes to get a cat to eat, open that can of tuna or use the tuna water. Open a can of sardines. Don't worry about things like phosphorus content. You're not feeding this as a long-term, main meal. If it's not actually toxic, try it. That includes cheese, hot dogs, lunch meat, and a fresh baked rotisserie chicken. A lot of supermarkets offer those now. They're fairly inexpensive. You get to eat whatever the cat doesn't. You bring home one that's still warm, nice and smelly. Peel off the skin, break up those bites pretty fine, and see. Now, maybe hand feeding a piece or 2 at a time is what it will take. But a lot of times our go-to when things wouldn't work was a warm rotisserie chicken. You know your cat, so beyond those, try things that your cat might like. Again, avoid onion, avoid chocolate, avoid artificial sweeteners. And that includes, in my opinion, sucralose, as well as xylitol and various others. Read the labels closely. Sometimes these things get buried, and sucralose will not have anything listed on the label saying artificial sweeteners. If none of this works and you have to start getting into other forms of treatment, Quite often you will not know whether it is stomach acid, nausea, or whatever is causing the problem. And I think it is better in that case to start with what I call the Trinity and just give all of them. Even if you never know which one of them helped, and it may be all three help, you need to break the cycle sooner rather than later. I'll get into why later. The Trinity includes Pepcid, or generic famotidine. That's for the stomach acid. 2.5 milligrams once a day is usually enough. An hour or two before bed to cover that time period during the night when they don't eat. And even if you're putting food out before you go to bed, sometimes cats don't eat it, or they eat it all early and they're still going 5, 6, 7 hours overnight with no food. That can cause the stomach acid to build up. So obviously one other option would be to get up at 3 o'clock in the morning and give the cat a little something to eat. If you're old like me and you're up at 3 o'clock in the morning on your way to the bathroom anyway, that's not difficult. Otherwise, Pepcid is your easiest option. You can give 2.5 milligrams twice a day if necessary. If there are kidney problems, that may cause some lethargy. If it does, you just cut back on the dose. Also need something for nausea. And nausea often has no symptoms other than not eating. A cat can have nausea and not throw up. So if your vet says, no, they're not nauseated because they're not throwing up, wrong. It's not that easy. Cats aren't simple. I prefer Serenia. Some people have more luck with ondansetron. I haven't. Depends on the cat. When giving Serenia, you have to get it into the back of the mouth, because if that gets onto the front part of the tongue, it's going to cause a lot of slobbering. It's not dangerous. It is somewhere between frightening and funny. It really annoys the cat, which is part of why it's frightening and funny. Don't get upset. Just ride it out, wipe off the slobber, and try to get the Serenia farther into the back of the mouth next time. Do not throw it into the back of the mouth. If you use a pill shooter, you always shoot off to the side a bit, because anytime you go straight down the throat with something, you risk it going into the lungs. So, side of the mouth, unless you're pushing it down in there with your finger, and then you don't want to shove too far. Next would be an appetite stimulant. And vets often start with an appetite stimulant, but if there's nausea, it just makes the cat hungry and they still can't eat. So I don't much care for that idea. My preferred appetite stimulant is Zyrtec, or generic cetirizine. This is an over-the-counter product, an antihistamine, but it does work as an appetite stimulant in many cats. You give it once a day, 1/4 to 1/2 of a 10 milligram pill. Side effects are rare. If you want to start with the 1/4 pill, fine and dandy. I've always used a 1/2 pill, but sometimes you got to experiment and see. If that doesn't work, cyproheptadine is another antihistamine that often helps in cats. It used to be the most commonly used years ago. You usually have to give it twice a day. Sometimes you can get away with once. It is a prescription you have to get through your vet. There's also mirtazapine, which is an antidepressant in humans. It's a very powerful appetite stimulant in most cats. It also has the highest risk of side effects, but those are mostly dose related. If you stick to 2 milligrams or less, you can give it every 1 to 3 days, usually have no problems. Higher than that, significant risk of side effects. That will usually start showing as increased vocalization. Then you can kind of get a drunken behavior or a zombie look where they just sit and stare. If you reach that point, you really have to stop the med. The counter to it is actually cyproheptadine. But the risk with mirtazapine is serotonin poisoning. If you continue to give it after those side effects start, you can end up with either a very sick cat or it can be fatal. I only use mirtazapine if nothing else works, and you have to be very careful with dose. There is a transdermal form called Mirataz. It's kind of hard to overdose with that because it's not a very strong mix, and it may or may not absorb well depending on the cat. Using that combination will solve most of the problems. How long you have to continue it varies. The only way you eventually know whether you can stop 1, 2, or all 3 of them is by experimenting. But if you stop, be ready to restart if problems show up. Don't let the problems get bad again. Don't be afraid to give these treatments. It is better to give them the pills than it is for them to not eat. If those don't work, well, even if they do actually, another option is slippery elm. My understanding for how this works is that it causes the body to produce more of its own mucus so that the protective layer in the digestive tract is thicker. So if there's inflammation and irritation in the system, and of course that happens often if you're on medication, this will help protect the digestive tissues so they can heal. Has a lot of other uses. Dose is generally 100 to 200 milligrams, 1 to 3 times a day. Some cats will take it in their food, some won't. It doesn't taste especially good, but not necessarily especially bad. It's typically in health food stores and some supermarkets. It is marketed mostly for humans. I believe Animal Essentials makes a liquid form for cats and dogs, which will be easier or harder depending on your cat. We keep some in the house because, hey, we take it. Another thing is B12 injections. I am extremely fond of B12 injections. Good for the kidneys, good for the digestive system, and it can stimulate appetite. A lot of vets are familiar with this, some are not. Some want to test before they use it. But even if the B12 tests normal, B12 injections may help. The risk is low. It's very low. Every once in a while, if a cat has been on enough B12 long enough, they'll end up with high B12, which will rarely but potentially cause some issues, and then you stop the B12. It is as low risk as things get. Issues with not eating. You may or may not already know this, but if a cat goes too long without eating, they run the risk of fatty liver disease. Some of the things you'll read on the internet tell you that a cat runs the risk if they go a day without eating. Got to read a little more closer. That only happens if a cat already has liver disease. So don't get overexcited if somebody tells you that a cat is in danger if they go a day without eating. That is rarely the case. 3 to 5 days of not eating at all is when a cat enters a slight risk for fatty liver disease. Hepatic lipidosis, I think, is the more technical name. 5 to 7 days, you're getting into a really significant risk. So you do have time to work with things. You should keep a look, watch the whites of the eyes. If you see yellowing in the eyes or anywhere else, you've got jaundice. You've entered, fatty liver disease more than likely. You need to take more aggressive action. The treatment for fatty liver disease is food. So you got to get a cat eating. If you get into the jaundice, you may end up on a feeding tube, or you may have to assist feed. If you've gone 4 days or thereabouts and you've tried these other things and they don't work, you probably should be assist feeding anyway. That may mean stuffing a bit of food in their mouth or syringe feeding. A lot of videos out there about syringe feeding. You need to kind of watch a bunch of them, figure out what works for you and the cat. It will make you feel very guilty. Cats don't generally enjoy this. There are a few that you can put that syringe out there and get them to kind of lap it up. Most of them will resist as best they can, but you'll feel a lot more guilty if you don't do it and you lose the battle. Syringe feeding has saved many cats. You get them over this and quite frequently you can resolve the issues and live a long time, a good life. So don't be afraid to syringe feed if you need to. Well, I'm sure I've forgotten something and I may have to do another video, but that covers most of it. These things will get almost all cats to eat. You may need to do blood work along the way or double check blood work that you've already done. Consider a gastric panel to check B vitamin levels, the folate, and the digestive enzymes. You could be looking at a pancreatic issue. Those are the things to do when you have time. And it's not bad to do some of those tests, every year or so anyway with an older cat, just to keep track. But the main thing is food, Pepcid, and a nausea, appetite stimulant. And then you go from there. Well, I hope you don't have this problem often and don't need to watch this video a lot. But I do hope it helps. And I hope maybe you watch the video before anything happens and can prevent it. As always, please click the thumbs up, subscribe, comment, and share the video. Good luck. Good cats. So long.